Hey there! In today's video, we're going to look at muscle tissue in some more depth. Did you know that there are over 600 skeletal muscles in the human body? And that for most people, muscle tissue accounts for about 40% of our total body weight. What do muscles do? Well, their main function is to produce movement, to allow us to walk, move around, talk, eat. Everything we do is driven by muscular action. Secondly, muscles are there to hold us and support our musculoskeletal system and hold us in posture, in good position. Thirdly, muscles generate heat when they contract and stretch, and this helps us maintain a healthy and even body temperature. In fact, nearly 85% of heat produced by the human body is due to muscle contraction. That's the upside and the benefits of having a properly and fully functioning muscular system. But as we age, if we don't intervene, we lose about 1% of muscle mass every year. But that's not the worst of it. Strength declines are 3 times greater than that. And the knock-on effect of that is that lower muscle strength is associated with increased dementia risk, a greater likelihood of needing care in older age, and a greater risk of mortality. In fact, research has shown that adults who strength train regularly show a 20 to 25% reduction in mortality from any cause and a 43% reduction in cancer mortality. Pretty impressive statistics. Strength training does this because it's anabolic. It stimulates muscle growth, strength, and even enhances cognitive function. It can also help increase bone strength and manage blood sugar levels, even in those with type 2 diabetes. Healthy muscle tissue also counteracts the catabolic effects of prostate cancer treatment. So if you're going through treatment for prostate cancer, it's really important to strength train. Strength training also helps enhance sleep. So working those muscles during the day, during your workouts, your weekly workouts, helps enhance your sleep pattern. It's been shown to improve depression and also helps with recovery from things like heart attack. In fact, low muscle risk is a major risk for general mortality. You can't have too much muscle. It puts years on your life and life in your years. Without strength training in middle age, both lean mass and bone mineral density decline. Whereas if you have favourable levels of lean muscle tissue versus your fat mass, that'll decrease the risk of sarcopenia or age-related muscle loss and associated bone loss and the risk of metabolic syndrome too. More muscle equals greater bone strength, equals greater retention of muscles and muscular strength, and it reduces your risk of all-cause mortality. And that's before we even get on to the topic of the aesthetics of it and looking good with a lean, toned body. I'm going to sum it up by saying your 1 or 2 quick hit workouts that you do each week, supported with good nutrition and getting enough protein for your nutrition to support and help with muscle protein synthesis, is doing the most proactively productive thing that you can possibly do for your long-term health and well-being, as well as making you look good. Muscle tissue itself is the driver, it's the engine, it's the motor of the human body. Look after that muscle tissue and it will look after you for many, many years.